what we will do, I hope you all can see the screen where questions are there. This is like the mock test, and we have almost 25 questions. We need to solve it. Ideally, in exam, we need to solve it within 25 minutes. We should keep 1 minute ka time. But here we have, I guess, 1 hour, that is 60 minutes for 25 questions, because I'll be also explaining about all the questions, how we are going to solve. Okay. Three things that you need to remember is: first, read question very carefully. Second, opt out the options for which you are sure this is not the answer. You should not attempt for the question where you know that this option is the answer. You should always opt out. Okay, this is not answer, this is not answer, fine, this is only the answer. Okay, you should not say, okay, C is correct answer, I know, leave other answers. No, that is the second rule. And third rule, always you can leave the questions for which you are completely not sure. If you have 50% hopes also, or idea that yes, this should be the answer, then you should attempt. Okay, because if that answer is correct, you'll get +4 mark. But after making 4 mistakes, there will be, if one also correct guess, then you'll get there won't be any impact on your marks. So always try to attempt more and more questions. Okay, these are the 3 basic things that I would suggest to follow. Now let's start with this. Which one of the following calcium channel blockers used as anti-anginal agent has the highest possibility to produce a negative inotropic effect? AV nodal block, bradycardia, decreased cardiac output, constipation, edema, and is contraindicated in sick sinus syndrome. So what do you think? What should be the answer? Please unmute and speak. I won't be able to check the chat box because of a test screen. So please unmute and share your guesses quickly. We do not have time. Any guesses? No one is speaking? No guesses? Come on, students. Any guess?
Okay. Nifedipine.
Okay, nifedipine, someone said. Fine. Now, do you know, when I was teaching anti-anginals, one statement was clearly said that calcium channel blockers should not be given in this CHF patients, because they have a lot of impact on directly cardiac tissue. Why? The major impact is by this verapamil. It has high selectivity to cardiac tissue. Okay, and that is the reason. And this is the only drug which is contraindicated in sick sinus syndrome. You might not be remembering this about this, but at least you should remember that verapamil has, in general, okay, verapamil has the highest selectivity for cardiac tissue compared to other calcium channel blockers, and that's why its impact is more. That is the reason it is contraindicated in CHF. So here, when other calcium channel blockers are also in option, nifedipine and diltiazem, maybe I'll go for verapamil rather than nifedipine, because nifedipine selectivity towards heart is less. Its selectivity towards blood vessel is more, and that's why more vasodilatory effect will be seen, which is required in as an anti-anginal drug, right? So I do not want any impact on heart, and verapamil is something which is having higher selectivity ratio towards heart, and that's why I will go for this. Okay, any query for this? Any question?
No, ma'am.
Keep guessing your answers, please, and quickly, that too. Oops. Okay, D-tuberculin, produces skeletal muscle relaxation by inhibiting. Any idea which, okay, which receptor, on which type of receptor it acts? Tubocurarine? Okay, so another simple thing, in exams you will see today, most of the questions are based on the classifications. Okay, mechanism and classification. If you remember mechanism and classification nicely, most of the guesses you can do. So here, any idea tubocurarine कौन से receptor पे act करता है? Okay, no idea. So here
Muscarinic action.
no, it does not act on muscarinic. Actually, it acts on neuromuscular junction. Yeah, in neuromuscular junction, it acts on nicotinic receptor. So this is a clear-cut direct question on which receptor this drug acts. So when you will be reading this cholinergic and anticholinergic drugs, there you will come across this, that there are different types of blockers, anticholinergic blockers, acetylcholine blockers. So in that, one is neuromuscular junction inhibitor. There, this tubocurarine will be acting on nicotinic receptor that you will come across. So I'll select this. This is a direct question. Okay. Now going to next, hemophilia A is caused due to the reduction in the quantity or activity of which of the following clotting factor? Now again, this is again a direct question. So in this clotting, the whole algorithm is there, right? Which factors are there involved in clotting chart? Now in that whole clotting pathway, there are different factors, and you will study in these textbooks, few diseases might have been given. Okay, कि ये factor के depletion के वजह से या deficiency की वजह से ये disease होता है. So hemophilia A कौन से factor की depletion के वजह से होता है? Again, this is a direct question. This is all about reading textbooks. ठीक है? Someone said something. What is it?
Clotting factor 8.
Clotting factor 8.
Yes, perfect. So this is a direct question. Clotting factor 8. Okay. I'll go ahead to which one is not an opioid receptor? Gamma, kappa.
Gamma.
Okay, gamma. How many opioid receptors are there?
3.
Okay. So do you think these three, mu, delta, kappa?
Yes, ma'am.
Yes,
And
ma'am.
there is fourth one
Yes.
also, which is known as OPL or opioid receptor, right? But gamma is not the one. So correctly guessed. And this I'll select and go ahead. Identify phase of clinical trial having following features. So I hope you all know कि clinical trial के phases होते हैं. कितने phases होते हैं?
4.
4 phases होते हैं. ये सारे clinical trial human being पे होते हैं क्या? या फिर कुछ animals पे भी होते हैं?
Ma'am, preclinical.
Perfect. So preclinical ones are on animals. Clinical trials में phase 1, phase 2, phase 3 होता है based on the number of human beings being involved. So phase 1 में बहुत कम होगा, phase 2 में थोड़ा ज़्यादा होगा, phase 3 में it's almost in 1,000 people, like 3,000. And phase 4 is something when the product has been launched, molecule has been launched, in actual real world, this is being prescribed by to the patients, and there, so clinical trial में हम clinical अगर article पढ़ते हैं तो बहुत बार ऐसा पढ़ा होगा कि patient with this disease was included, patient with this side effect or this allergic conditions were excluded, ऐसा करके, right? Inclusion exclusion criteria होता है. तो clinical trials में हम selective patients लेते हैं phase 1, phase 2 और phase 3 में. बट फेज 4 में जब एक्चुअल रियल वर्ल्ड में ड्रग जाता है, डॉक्टर डू नॉट सेलेक्ट द पेशेंट बेस्ड ऑन इंक्लूजन एंड एक्सक्लूजन क्राइटेरिया. दे सी ओके ये पेशेंट को ये है, ये डिजीज है, मैं ये दे देता हूँ. वो फिर ओल्ड एज भी हो सकता है, यंग एज भी हो सकता है, कैसा भी हो सकता है, राइट. सो अलग अलग पॉपुलेशन का एक्सपोजर होता है ड्रग से, and then what is the side effect, how the molecule is behaving, that is observed in phase 4 after launching. ठीक है. So here almost 3000 patients are there and safety and tolerability is evaluated on a wider scale with large number of patients. So which clinical trial it must be?
3.
Phase 3.
Phase 3.
Correct. So here this is phase 3. Now I'll go ahead. Split up of time cycle of cardiac cycle. So this you must have come across. Cardiac के बहुत topics हमने पढ़े हैं and this is very basic, right? Maybe APP में कहीं initially पढ़ा भी होगा. So which one is the correct option?
Ma'am, A.
Option A.
Perfect. So atrial systole and atrial diastole is for 0.1 second and 0.7 second. I always remember this one. Atrial systole is for 0.1 second, rest 0.7 second is atrial diastole. And इसका थोड़ा overlapping है, ये 0.1 second के बाद vascular systole start होता है. Atrial systole के 0.1 second के बाद. I'm not able to change the screen because I've already started the test. Otherwise, I'll show you these images later after submitting the test, where ventricular systole is for 0.3 second and ventricular diastole is for 0.5 second, which is actually this 8.8 second is delayed by 0.1 second of this 0.8 second. This you will understand what I'm talking after seeing that image. But yes, A is the correct answer, which I'll select as suggested by you and go ahead. Vigabatrin produces anti-epileptic activity through. So epilepsy में क्या होता है and which most of the options if you see they are talking about GABA. So GABA को हमको कम करना है या ज़्यादा करना है?
ज़्यादा करते हैं.
Increase.
We need to increase GABA. Why? Why?
To suppress the neuronal excitation.
Yes. Okay. So here we need to increase GABA, right? So हमको पहले तो सारे ऑप्शन रीड करने हैं, क्या सब में इंक्रीज हो रहा है GABA? So potentiating GABA mediated neuronal inhibition, इसमें inhibit हो रहा है. Yes. Increase हो रहा है. But by acting on GABA transporter. Let's go to second option. Modifying synaptic release of glutamate or GABA by binding to a specific synaptic protein. यहाँ पे the vigabatrin is binding to some synaptic protein. C, here it is inhibiting some GABA transaminase enzyme and that's how it is reducing GABA levels. In fourth option, it is potentiating postsynaptic GABA receptor effect. So here it is increasing directly. Right? Here it is directly increasing. Here it is indirectly increasing. And यहाँ पे भी increase है. So there is increase of GABA effect in A, C, and D options. But through which mediator? Through which mechanism? How it is actually acting? So उसके लिए we need to remember vigabatrin का mechanism. Anyone remembers vigabatrin का mechanism?
Option C. Transaminase inhibition.
Right. So ये enzyme is inhibited. And that's how the degradation of GABA is reduced. GABA ka levels will increase. Okay. So I'll select this and go ahead. Meloxicam belongs to which class of non-steroidal anti-inflammatory drugs? I hope you remember NSAIDs में COX-1 inhibition, sorry, non-selective inhibition होता है जिसमें COX-1, COX-2 दोनों inhibit होते हैं. And there is COX-2 selective inhibition where only COX-2 enzyme is inhibited and not COX-1. But there is a term called preferential COX inhibition also. Okay, that means completely selectiveness नहीं होगा उस drug का, but preferentially ज़्यादा वो COX-2 को inhibit करेगा compared to COX-1. So now tell me, meloxicam जो है, what is it? It inhibits which one? Is it selective COX-2 inhibitor? Selective COX-1 हो नहीं सकता है. No NSAID is selective COX-1 inhibitor. ठीक है? So B is out. A can be the option. Do you remember selective COX-2 inhibitors? Which drugs are in this class?
Celecoxib.
Yes, all the coxibs, they are selective COX-2 inhibitors, celecoxib, etoricoxibs, or all those. So selective COX-2 inhibitor में actually coxibs come. So meloxicam नहीं आ सकता है. COX-1 inhibitor selective होता नहीं है. So now preferential COX-2 and preferential COX-1 बचा. Preferential COX-1 वापस नहीं होता है. It can be preferential COX-2 inhibitor. So the remaining option is preferential COX-2 inhibitor, which is actually the correct answer. Meloxicam and nimesulide are the two NSAIDs which are preferentially inhibiting more COX-2 enzyme rather than COX-1. So that's how I'm ending up with this option. Any question with this queries with this question?
No, ma'am.
Yeah, even if I don't know about preferential COX-2 inhibitors, I ended up by opting out the other options, right? COX-1 selectiveness ऐसा NSAIDs होता नहीं है. Now coming to next question, which of the following is not one of the triad effect of adrenaline leading to rise in blood pressure? So इनमें से कौन सा effect नहीं होता है in triad effect of adrenaline? What is the triad effect of adrenaline? What is the triad effect of adrenaline? No one remembers it? Okay, it is actually adrenaline is okay, it is leading to rise in blood pressure because of vasoconstriction, right? So vasoconstriction, if you see A, vasoconstriction हो रहा है, ठीक है. Second, increased heart rate. Can adrenaline cause increased heart rate? Is it one of the effect of adrenaline? Yes or no?
Yes.
Yes. Okay. हार्ट पे कौन सा रिसेप्टर होता है? एड्रेनर्जिक कौन सा रिसेप्टर होता है?
Beta 1.
Beta 1.
Beta 1.
बीटा 1. एंड मस्कैरेनिक में कोई होता है?
M2
Yes.
receptor.
M2 is there, right? So here beta 1. Now beta 1 में कैसा है ना? The effect on this is more. What you say? Contraction. So inotropic is effect is more compared to chronotropic. I'll keep this as an option. ठीक है? Here they are talking about chronotropic action. So chronotropic action is also there with adrenergic drugs, but it is less compared to inotropic effect. So I'll keep this as option. If I don't find other answer, I'll select this one. Now coming to third option, a direct myocardial stimulation that increases strength of ventricular contraction. So this just now I mentioned beta 1 cell agonism will cause increased inotropic effect, जहाँ पे force of contraction बढ़ जाएगा, right? So C is cannot be opted out. This is true. Now D, stimulation of synaptic alpha 2 receptor leading to increased sympathetic tone. Can it be true? Can this be true? अल्फा 2 रिसेप्टर जो होता है वो प्री साइनेप्टिक जंक्शन पे होता है, राइट? देयर इज प्री साइनेप्टिक जंक्शन, देयर इज साइनेप्टिक क्लेफ्ट एंड देन गैप एंड देन पोस्ट साइनेप्टिक रिसेप्टर. सो प्री साइनेप्टिक रिसेप्टर पे जो अल्फा 2 रिसेप्टर होता है, when that is getting activated by adrenaline, what happens? This pre-synaptic neuron, this will stop releasing more and more adrenaline, because alpha 2 is getting a message that there is already too much adrenaline in the gap junction, which is coming back to this alpha 2 receptor and stimulating. So it will send a negative message to the pre-synaptic cleft and junction, and it will reduce release of adrenaline. So what will happen? The reduction in release of adrenaline will be there. But what they are writing, stimulation of presynaptic alpha 2 adrenoceptor leading to increased sympathetic tone. It is not increasing sympathetic tone, right? It is reducing sympathetic stimulation, the release of adrenaline. So this is a wrong statement. I was confused between B and D, but here I'm sure that this is completely wrong. So I'll go for this. Okay, this is not the effect. Even if you do not know about triad effect, this is not the effect of adrenaline in rising the blood pressure, because the statement is incorrect. Is this fine?
Yes, ma'am.
Yes. So see, I'm telling you, you might not be knowing the answers of all the questions, but here what we are doing based on our basic knowledge, we are trying to apply logic and opt out the most of the options and end up to selecting one option. Okay, that's how I'm trying to answer the questions. So I'm selecting this and going ahead. Now, which of the following statement is true for cancer cells? Okay, any guesses? Oncoprotein produced by cancer cells act on neighboring cell. Is it true? Is it true? Okay, for this you'll have to read the cancer topic, but basic I'm telling you here. Cancer में क्या होता है? There are some oncoproteins which are formed in tumorous cells. ठीक है? वो लोग ट्यूमर सेल का ग्रोथ और डिवीजन और बढ़ाएंगे, मल्टीप्लाई होगा ट्यूमरस सेल, बट दिस डज नॉट एक्ट ऑन नेबरिंग सेल. वो उसी ट्यूमरस सेल को ही और ग्रो करेगा. देयर विल बी अनकंट्रोल्ड ग्रोथ ऑफ दैट tumorous cell, but it will not act on neighboring cell. ठीक है? The same tumorous cell may spread. It will move from this place to another place called metastasis, but that will not impact neighboring cell. So this is not true. Cancer cells produce oncoproteins in absence of growth factors or external stimuli. Now this is true. कैंसर सेल्स को बाहर से कोई भी स्टिमुलस नहीं चाहिए, ग्रोथ फैक्टर का या कोई भी स्टिमुलाई नहीं चाहिए. नहीं भी है ग्रोथ फैक्टर का स्टिमुलाई तो भी वो अपने आप ग्रो होता रहता है. दैट इज द प्रॉब्लम, राइट? दैट्स व्हाई सिंस बिकॉज बाहर का कोई एक्सटर्नल स्टिमुलाई नहीं उसको चाहिए, विदाउट दैट आल्सो इट इज ग्रोइंग uncontrollably. That is the reason why we are not able to control its growth. So this one is true. Cancer cells require stimulation by growth factors. This is not true. It does not require the stimulation. So these two are contradictory statements. So definitely the answer will be between B and C, right? Absence of growth factor, it requires stimulation. So ये दोनों में से कोई एक आंसर होगा. Cancer cells are highly sensitive to growth inhibitory signals. So this is again not true. Because as I mentioned, बाहर से कोई भी सिग्नल या स्टिमुलाई का उसको फर्क नहीं पड़ता है कैंसर सेल्स को. It grows in absence of external stimuli. So B will be the correct answer. Here, I am just reading the options carefully. Since they are contradictory, I am trying to apply some logic. बाहर से stimuli नहीं चाहिए, so C and D will not be the option and B will be the correct option. Is this fine?
Yes,
Okay,
ma'am.
go ahead. Okay. Now going to next, except one of the following pairs represent drugs used in the treatment of glaucoma and their primary mechanism. Select the wrong pair from the following. Okay, now they have given different classes of drugs and their impact. क्या हो रहा है? Decreases aqueous outflow, increases aqueous outflow, increases aqueous outflow, and here it decreases aqueous formation. Okay, so different options have been given. What do you think? What will be the answer here? So for this, again, you'll have to read the topic carefully. There is one, statement about prostaglandin analogs. So all the other class of drugs, they are acting on, aqueous humor of the eye. It is related to eyes, right? So they are acting on the aqueous humor of the eye. But the prostaglandin, this is the only class of drug which is not impacting aqueous humor. It is actually increasing this uveoscleral outflow. Okay, it is increasing uveoscleral outflow. So that's a different mechanism for prostaglandin. This is also used for glaucoma, but through a different mechanism, unlike other class of drugs. So for this, you will have to read the topic and will, the mechanism, how different class of drugs are acting. So this, I'll go ahead. To monitor the safety of the new drug under actual conditions of use in large number of patients has been classified as clinical trials. Which phase? I had explained this in last question. Here, which phase it will be?
Phase 4.
Phase 4.
Phase 4.
Phase 4, right? So which word is making me think about phase 4? Actual conditions, okay, of use. So that is like in real world, this is being used. So, and here always it's about safety, okay, to monitor the safety. Phase 4 में efficacy नहीं देखते हैं. Efficacy already phase 3 में establish हो गया है. Phase 4 में सिर्फ safety देखते हैं कि real world में ये molecule safe है या नहीं. So that is phase 4. And phase 3 में efficacy safety दोनों देखते हैं. Okay, coming to antifungal agent 5-fluorocytosine is converted to its active metabolite 5-fluorouracil by one of the following fungal enzymes. So this is an antifungal drug. It's a very clear, antifungal topic is very small topic, classification or हर एक class का mechanism. Now 5-fluorocytosine का, what do you think, which enzyme is getting converting this inactive drug to active metabolite 5-fluorouracil? Any idea? So इसके लिए you'll have to remember the fluorocytosine and fluorouracil का structure. Even if you forgot the enzyme or you don't know the enzyme का name, you will have to know the structure at least. Fluorouracil and cytosine कैसे दिखता है? Any guesses at least?
Option A.
Yes, option A is correct. If you have read, very good. And if it is a guess, still very good. Correct guess. So here what happens? 5-fluorocytosine में NH2 group, functional group होता है, which is getting deaminated in presence of this cytosine deaminase enzyme. and उसका keto group हो जाता है. The NH2 group is getting converted into keto group. So that's why it is called the enzyme which is used for this step is cytosine deaminase. And this is present in the fungal cell. So after this conversion, this 5-fluorouracil is incorporated in the RNA of fungus, and that's how the growth of RNA of fungus will be inhibited. Okay. Now, this is related to diabetes. Which among the following statement is correct with respect to their mechanism? All the anti-diabetic drugs are given here and their mechanisms are given here. So we have to select which is the correct option. Okay, always read question carefully. They ask, sometimes they ask correct option, sometimes they ask for incorrect answer. Here they are asking for correct option. Okay, sitagliptin and vildagliptins. Are they DPP4 inhibitors? Are they DPP4 inhibitors?
Yes.
Yes, ma'am.
Yes, so this is true. Actually, they inhibit DPP4 enzyme. DPP4 enzyme क्या करता है? What's the role of DPP4?
मैम वो डायबिटीज के क्लासिफिकेशन में ना, जिसमें मैम वो जो रेजिस्टेंट सेल होते हैं.
Okay, so you have read the classification, but you forgot the role of DPP. It's correct. It is DPP4 inhibitor. DPP4 जो enzyme होता है, that is actually breaking down the incretins and incretins. Okay, and incretins जो है, they are showing positive effect on insulin. Like more insulin will be there, so more glucose metabolism will be there. And incretins are being broken down by DPP enzyme. So that's why we need to inhibit this enzyme. You need to read the topic again to remember the mechanism, but this is proper classification. I'll just confirm next classifications also. Never leave, as I said, never leave other options if you know one option is correct. Okay. Dapagliflozin and canagliflozin. Are they AMPK activators?
No,
That
ma'am.
means AMP induced potassium channel openers. Someone said no, and yes, it's actually SGLT2 inhibitor. Okay, GLUT transporter 2 inhibitor. Glympyride. What is the mechanism of glympyride? Do you remember? It is glympyride is actually opening potassium sensitive ATP channel, and that's how it is increasing insulin secretion. Metformin come different mechanisms hai, but acarbose, they do not have same mechanism. Acarbose is something that is reducing the breakdown of complex sugar molecules into simple glucose molecules. So uska absorption ही reduce करता है. So acarbose is something which is acting on GIT. This is not the mechanism. So I'm sure that rest of the three options are incorrect and A is correct. So I'll select that. Going to next question. Long-term use of thiazide diuretics in hypertension can produce all of the following except. So diuretics, they are acting on electrolytes, right? Sodium, calcium, potassium, all these ions का absorption and reabsorption is impacted. तो हमको देखना है कि इनमें से कौन सा साइड इफेक्ट होता है डायूरेटिक्स में. Now tell me which one will be the answer for thiazide diuretics. Like this is not the side effect because they are saying which one is produced except. Matlab, whatever we will select, that will not be the side effect of thiazide. Which one is not? Hyperlipidemia. Okay. Any other options?
Option A, hyperkalemia.
So yes, I will be also confused between A and C. Hyperglycemia and hyperuricemia are definitely the side effects of these thiazide diuretics. But I'll go for hyperkalemia. Why, you know? Because I know this is specifically associated with potassium sparing diuretics. Do you remember potassium sparing diuretics? They are sparing potassium ions in the blood. They are not letting it excreted from the body. उसका excretion कम कर देता है. Although urine formation बढ़ा रहे हैं, but potassium का excretion कम कर देता है. That's why they are called potassium sparing diuretics. And that is the reason कि कभी-कभी कुछ ज़्यादा ही potassium levels हो जाता है blood में. Now this is the side effect only associated with potassium sparing diuretics. This statement I know. So I will select this one कि thiazide में नहीं होता है hyperkalemia. Is this fine?
Yes, ma'am.
Okay. Now, one of the following statement with respect to carbachol is not correct. Now, rest 3 will be correct, 1 will not be correct. Can it be administered orally? It possesses both muscarinic and nicotinic action. It is more susceptible to hydrolysis as compared to acetylcholine. The amino group decreases electrophilicity of the carbonyl. Now here, first of all, tell me carbachol is from which class of drug? It is from which class of drug?
Sympathomimetics.
Sympathomimetic, yes. So it is actually acetylcholine agonist. Being
Agonist.
specific, yes, it is acetylcholine agonist. Now, if you have read the SAR of acetylcholines, तो carbachol जो होता है ना, that is there for longer time in the blood compared to acetylcholine. Why? Because उसका metabolism acetylcholine esterase से कम होता है compared to acetylcholine. इसका metabolism कम होता है. The esterase enzyme will break down less carbachol compared to acetylcholine. So as per this basic knowledge of carbachol, what I can understand here, if it is more susceptible to hydrolysis, acetylcholine compared to acetylcholine, it cannot stay in the blood for longer time, right? Compared to acetylcholine. So this is the one statement that I'm finding incorrect. I'm not sure if it is available orally or not. The molecule, the formulation. This I know it possesses both muscarinic and nicotinic action. Yes. The amino group decreases electrophilicity of the carbonyl group. This will be another thing from medicinal chemistry point of view. If you know the structure, you will be able to figure this out. But based on my basic knowledge, I'm able to choose this answer at least. This I'm sure that this is not the correct option. Is this fine with you all or any different opinion? Any different opinion? Yes or no? Hello? Am I audible? Hello?
Yes, ma'am, you're audible.
Okay. Any different thoughts or is this fine? Are you all agreeing with me that carbachol is there for a longer time in blood compared to acetylcholine and that's why it cannot be more susceptible to hydrolysis? Is this fine? क्या हुआ? At least say yes or no. If you have no, then what is the query? Hello?
Yes.
What
ma'am.
happened? Okay, I'm assuming that you have no queries because you all are so silent. I'll go ahead. A hypertensive patient, Mr. Z, already receiving a drug X to control his blood pressure. ठीक है, एक एंटी हाइपरटेंसिव ड्रग ले रहा है वो. He was prescribed a tricyclic antidepressant also. वो patient tricyclic antidepressant भी ले रहा था. This resulted in the abolition of the antihypertensive action of drug X. Matlab, there is a drug-drug interaction. So which drug is getting interacted with this tricyclic antidepressant? Now you'll have to remember this major drug interactions also. Because most of the time, the drug interaction ka questions will be like this only. That ye patient ko ye disease hai, ये डिजीज भी है, सो एक्स डिजीज के लिए ये ड्रग ले रहा है, वाई डिजीज के लिए ये ड्रग ले रहा है. विल देयर बी एनी इंटरैक्शन, या फिर which drug should not be taken? That's how the question will be given. Now here they are asking which antihypertensive drug will be having drug interaction with tricyclic antidepressant. Any one remembers? Have you read anywhere this one? No one? Okay, now this is a direct question. If you read more textbook, you'll come to know. So here the answer is Clonidine, which is actually showing drug-drug interaction with tricyclic antidepressants. Okay? Autorhythmicity is present in which of the following group of tissues? Autorhythmicity means autorhythmicity. Okay. I mean, what is the issue? Why are you not speaking anything? This is not something real test, right? We are just attempting. So you can share your thoughts also. Autorhythmicity मतलब क्या होता है? Hello, this is the basic question.
They generate their own rhythm. They do not need any external stimulation.
Correct. They do not need any external stimulation in the body, right? वो organ खुद ही अपना stimulation करेगा. Now, cardiac muscles, do they produce their contraction themselves? Do they have
Yes,
autorhythmicity?
Yes,
Okay.
ma'am.
Okay. Neuronal tissue, do they have? Do they have
ma'am.
autorhythmicity? Okay, you are saying
Yes,
yes.
ma'am.
Skeletal muscle, do they have? Do they have autorhythmicity? First
No,
of all,
ma'am.
that is no, correct. So that is a voluntary muscle, right? Skeletal muscles. I have control. So whenever I want, I'll move that skeletal muscle, and then there will be contraction or relaxation. So this is not autorhythmic. Visceral smooth muscles, they are also not autorhythmic. There are some stimulation, external stimulations, which are causing contraction or relaxation of smooth muscles, right? Visceral smooth muscles. So these are the two tissues which are showing autorhythmicity, and A is the option where two are together. Baki sab mein, it's not in correct pair. So going ahead, which one of the following is an organ specific autoimmune disease? Autoimmune disease मतलब खुद का बॉडी का इम्यूनिटी सिस्टम खुद के बॉडी के सेल्स पे या ऑर्गन्स पे अटैक करने लगता है, राइट? Now all these are actually autoimmune disease. We need to find which one is organ specific. So,
Option C.
okay, someone said option C, that is rheumatoid arthritis. Arthritis मतलब कौन सा organ affect होगा?
Bone, joints.
Joint.
Can
Joint.
bone joint be an organ?
No, ma'am.
No, ma'am. No specific location is there actually.
Yeah, specific location hai, but then not organ specific, right?
Yes, ma'am.
Okay. Graves disease में क्या होता है? Graves disease is related
It's
to which?
related to thyroid gland.
Thyroid gland. Is it an organ? Thyroid gland organ है?
Yes.
Can you call a gland
No.
organ? No, it's a gland. It's not an organ. ठीक है? Okay. Scleroderma is what?
Related to skin.
To skin.
Related to skin. Correct. Okay. Skin, is it an organ?
Yes, ma'am.
Yes, ma'am.
Yes, it is the largest organ of the body,
Largest
right?
organ.
So this is autoimmune disease also, and this is specific to some organ. अगर skin पे कहीं भी हो रहा है, that is fine, but वो skin पे ही हो रहा है. So it is organ specific autoimmune disease. So this is one option I'm preparing to select. Polyarteritis मतलब arteritis का क्या meaning होगा?
Inflammation.
Inflammation means itis. Fine. Arteritis मतलब arteries में inflammation.
Arteries.
Right? So this is related to blood vessels. Now blood vessels cannot be an organ, right? So we will go for scleroderma, which is organ specific autoimmune disease. ठीक है? Even if I don't know, I mean, this is again logical question. If you know about the diseases, you have to apply some logic and select the option. ठीक है? Any question, queries with respect to this one?
No, ma'am.
Great. I'll go ahead now. Which of the following neurotransmitter is formed on demand and act immediately? On demand form हो रहा है मतलब वो store नहीं होता है. Form होता है, immediately release होता है और उसका action दिखता है, right? Now tell me, out of all these four, कौन सा store नहीं होता है? Adrenaline, histamine, nitric oxide, acetylcholine. Which one is not
Nitric
stored?
oxide.
Nitric oxide.
Nitric oxide, right? So this is the correct answer. बाकी तीनों storage vesicle में store होते हैं and then they are released. So this is formed on demand. Now coming to next, identify the diuretic which causes hyperuricemia, tend to raise serum calcium, and also causes magnesium depletion.
Chlorothiazide.
Perfect. It's the correct answer is chlorothiazide. Now here, I'll show you. So you know, furosemide class of drugs and chlorothiazide, that is loop diuretics and thiazide class of drugs, they have mostly similar side effects. But calcium के बारे में they have some different side effects. Furosemide में hypocalcemia is written as a side effect, whereas chlorothiazide, thiazide class of drugs, they show hypercalcemia, that is raised serum calcium levels. So that is the difference between furosemide and chlorothiazide. And that's why I'm selecting chlorothiazide based on this calcium side effect, hypercalcemia. Okay. So ये जो summary table होगा ना, एक I'll show you, maybe you can take screenshot of that. That summary table is very important for side effects of all the diuretics. Two-pore domain potassium channel are opened by which of the following categories of anesthetics? Now, ये आपको mechanism पता है, then you can write the answer. Barbiturates कैसे act करते हैं? What's the mechanism?
Chlorine channel पे act करती है.
Chlorine channel पे. Okay. Opioid analgesics. Opioid analgesics. They are acting on opioid receptors, right?
Yes, ma'am.
GPCR type of opioid receptor. Benzodiazepines. Benzodiazepines.
CNS depressant.
Same.
CNS. So barbiturates or benzodiazepines, they are actually acting on GABA, right?
Chlorine channel, GABA mediated chlorine channel.
And although, as you mentioned, chlorine channel ke through, so true, but they are acting on GABA. Halogenated inhalation anesthetic. These are the ones which are actually inhibiting this opening the potassium channels and hyperpolarizing the cells, and that's how they are causing neuronal cells, and that's how they are inhibiting, because of hyperpolarization, they are inhibiting the impulse generation in the neurons. So this is the correct option. I'm sure about the mechanism of REST3, that they are acting through different mechanism, and I know halogenated ka bhi mechanism, so I'll go for this one. Is this fine?
Yes, ma'am.
Yes, ma'am.
Now, which of the following drugs possess antiplatelet effects? Okay? So antiplatelet effect. Now, desmopressin. Any idea iska mechanism kya hai? What effect it shows? Desmopressin. Okay. As the name of the molecule is suggesting, as I'm saying again and again, हाँ मुझे भी सारे आंसर नहीं पता होंगे, but then थोड़ा logic try करना है, and are you able to reach to some one option, and then you have to decide कि attempt करना है या नहीं करना है ये question. So here, which of the following drugs possess main desmopressin? As the name of the molecule is suggesting, isn't it similar to vasopressin hormone?
Yes, ma'am.
Yes,
Right?
ma'am.
Vasopressin is nowhere related to platelets, right?
Yes,
So I
ma'am.
am opting this drug out. Clopidogrel का mechanism पता है? Yes, क्या है उसका? No? Okay, see, I'll come to fourth option, erythropoietin. Now, erythropoietin is, as the name is saying, erythro means red blood cells, poietin matlab formation. So red blood ka cell ka formation mein this will help. So this is not having antiplatelet effect. There are two options with which I am left, clopidogrel or urokinase. So they both are in, blood wala chapter. Now, what is the difference between them? Urokinase is fibrinolytic drug. वो fibrin का formation कम करता है, and clopidogrel is antiplatelet drug. So this, with this basic, classification knowledge, you will be able to select the correct answer. Okay. Wheel and flare reaction is characteristic reaction associated with identification. Which type of hypersensitivity reaction?
Type 1.
Type 1. So type 1 hypersensitive, I'll show you different types of hypersensitivity reactions ka kya there are different symptoms, like because of involvement of different immunoglobulins. इसमें कौन सा immunoglobulin involved होता है?
IgE.
IgE, which is inflammation related, right? So that's why wheel and flare is the reaction in this. Which one of the following is not an endogenous opioid peptide? Okay, now I had given this
D1.
D, okay, which is correct answer. So this is actually this we had discussed during opioid topic. It was given directly in the slides also, so that these from this textbook only. So these are few endogenous opioids present in our body, which are helping in analgesic effects normally. Beta endorphin is the one more one, okay, not lipotropin. They are confusing us, trying to confuse us between beta lipotropin and beta endorphin. So beta endorphin is the another one, which is endogenous opioid peptide, but they have written something else. So I'll go for D option. So we have completed 25 questions. I'll submit the test.